Hello, I'm Rachel McKenty, Director of Programs and Development at Legacy Education. Thank you for joining me for the CPB CPB Practice Exam Review. In this presentation, we will review modifier questions from the CPB CPC Practice Exam. We will review 10 questions. The CPT inside cover page is a list of the most common modifiers used in coding. There are several missing, however, like anesthesia. You'll find those along with others in your HCPCS manual. There are several with corresponding definitions that you'll want to reference. Question 1. What modifier is used to indicate two procedures are performed on the same day and should not be bundled? The key words in this sentence has to do with the charges, which are noted as two procedures. Understanding modifiers can make quick work of these questions. Let's review each option and make some notes in your CPT manual along the way. Mark this in your code books. Modifier 21 is for significant, separately identifiable evaluation and management. There is no evaluation and management in this question because they have told you it's two procedures, making A incorrect. Modifier 24 is unrelated E&M. Again, it's two procedure, making B incorrect. Write in E&M major surgery next to modifier 57 to remind you this modifier is used when an evaluation and management service resulting in the decision for surgery, a major surgery. It is applied when the E&M service leads to the decision to operate and the surgery is scheduled for the same or the next day. The modifier is typically used with procedures that have 90-day global periods, distinguishing the E&M service as the determining factor for the surgery. Another E&M modifier, making C incorrect. Modifier 59 is used to indicate two procedures should not be bundled, making D the correct answer. Take a moment to pause this page and make these notes and any annotations to help you remember these tips along the way. Question 2. Modifier 59 is used to unbundle procedures with an indicator of 1. Under what circumstances would modifier 59 not be appropriate? Modifier 59 is used when a procedure is independent of another or could represent a different site, organ system, separate incision, separate lesion, or a separate injury. Let's review the answers. A benign lesion is removed from the upper left side that does not need suturing. A second benign lesion is removed from the lower left thigh but needs an intermediate suture. This qualifies for modifier 59 because it's two different lesions at different sites. B. Destruction of a premalignant lesion on the medial side of the right ankle and a biopsy of a second lesion on the arm. This qualifies because it represents different sites, different lesions. C. Breast nodules removed from the right breast at 3 o'clock and at 9 o'clock. This qualifies because it's different sites. And finally, D. Strapping of a fractured left ring and left pinky finger. The other rule about modifier 59 is that if one of the specific anatomical modifiers, like right-left or something like that, is available, those can be assigned, and it should be used instead of modifier 59. Strapping of the fingers can be billed with modifiers F3 and F4 to describe the separate locations. Therefore, D is the correct answer. Question 3. Which of the following is considered an anatomical modifier? 77, LD, 59, or G0? Let's review our anatomical modifiers first. The most obvious is right and left. Next are the eyelid modifiers, which are E1 through E4. FA and F1 through F9 are for fingers. TA and T1 through T9 are for toes. HCPCS modifier LM is used to identify the left main coronary artery. The RI modifier is used to indicate the ramus intermedius coronary artery. LC is the left circumferential. LD is the left anterior descending coronary artery, and RC is the right coronary artery. This makes B our choice and is considered an anatomical modifier. Question 4. Review the following table to answer the question below. We have a table here with column 1 and column 2 edits. We can see that column 1 is CPT code 43100. Column 1 contains what is known as the primary procedure code. This column lists the primary CPT or HCPCS code that, when billed with a code in column 2, might have billing restrictions based on NCCI edits. Column 1 procedures are typically considered the more comprehensive service, and they are often reimbursable when billed on their own. Column 2, on the other hand, lists the secondary procedure that is often viewed as a component of the procedure in column 1. If both codes are billed together, there may be bundling restrictions unless a specific modifier, like modifier 59 or other appropriate NCCI associated modifiers, is applied, showing that the procedures were distinct and separately identifiable. These edits help prevent unbundling and improper coding practices. The last column is indicating if a modifier is allowed to override the bundling edit. We can see that 2 have a 0, which means there are no modifiers that will override the edit. The final 2 have an indicator of 1, which means a modifier could be used to override the edit. Examples of modifiers that can be used to override edits are 57, 59, and 25, all of which are answers to our questions. Let's review that now. What modifier would be appended to code 0216T when billed with code 43100? This particular code combination has a 0 in the modifier indicator field, which means a modifier is not allowed. When we review the answers, only D, no modifier allowed, is correct. Question 5. What information is conveyed for the code pair 11042 and 11001? A modifier is not allowed and will not bypass the edits. A modifier is not allowed and will bypass the edits. A modifier is allowed and will bypass the edits, or the use of a modifier is not specified. We want to look at our modifier column. As a reminder, 0 is for not allowed, 1 is for allowed, and 9 is for not applicable. The indicator of 9 means the use of modifiers is not specified. This indicator is used for all code pairs that have a deletion date that is the same as the effective date. This indicator was created so that no blank spaces would be in the indicator field. Reviewing our answers, only D is correct. The use of a modifier is not specified. Question 6. Which of the following modifiers will appropriately bypass the NCCI bundling edits? The modifiers that may be used to bypass the NCCI edits include modifier 24, modifier 25, modifier 57, 58, 59, 78, 79, and 91. Take a moment to note these in your books that these will bypass the NCCI bundling edits. Knowing this information, let's evaluate the options. Which of the following modifiers will appropriately bypass the NCCI edit? Modifier 25, yes. Modifier 52, no. Modifier 62, no. Modifier 58, yes. This makes A our answer. Question 7. A claim is submitted for an assistant surgeon. What modifier would not be used for an assistant surgeon? Modifiers 80, 82, and AS can all be used for an assistant surgeon depending on the payer and the modifier. Modifier 80 is used for an assistant surgeon during the procedure. AS is used for a non-physician assistant at surgery services for Medicare beneficiaries. Modifier 82 is used by a physician in a teaching facility when a qualified resident is not available. Modifier 62 is used when two surgeons are involved, but they meet the definition of co-surgeon and not assistant surgeons. So this would make D the correct answer, modifier 62. Question 8. Sally is a 45-year-old female, established patient seen for an annual gynecological exam. The physician performs a comprehensive history and detailed exam. During the exam, a cervical polyp is seen, and the decision is made to remove the polyp with ring forceps. What codes are reported? When reviewing the answers, I can see that 57550 is included in all the answer choices. Noting this will save me time later. The patient was seen for an annual gynecological exam. This is a preventative service. Preventative services are found under evaluation and management. Look in the CPT index for evaluation and management preventative services, referring you to 99381 through 99429. Code selection is based on the age of the patient and whether the patient is new or established. Since this is a 45-year-old established patient, the correct code would be 99396. If this were the exam, I would choose option B now, as it's the only option that includes a CPT code. And we know that the procedure was done, and the procedure is listed as an answer choice in all 4 questions, so we know that's correct. But for understanding, let's code the polyp. Look in the CPT index for cervical biopsy, and you are referred to 57500 and 5720. The correct code to report is 57500. The answer is D, still. In Sally's case, a modifier 25 would be used on the Evaluation and Management Services code to indicate that the physician provided a separately identifiable E&M service in addition to performing a procedure was the polyp removal on the same day. Although Sally came in for an annual gynecological exam, the physician identified a cervical polyp during the exam, requiring an additional decision and procedure to remove it. Since the E&M service, the annual exam, was significant and went beyond the usual pre- and post-procedure care related to the polyp removal, the modifier 25 distinguishes it as a separate service. This allows for the appropriate billing of both the preventative exam and the polyp removal, as the E&M service wasn't solely focused on or inclusive of the procedure. Question 9. When a patient is seen for evaluation and the decision is made for a minor procedure that is performed on the same day, which modifier is appended to the claim to allow reimbursement for the E&M and the procedure? We have modifier 57, 59, 25, or no modifier is necessary. In coding terms, the difference between minor and major procedures largely hinges on the global periods, which determine the duration of postoperative care included in the procedures and thus not separately billable. Minor procedures typically have a global period of 0 or 10 days, encompassing pre-procedure, inter-procedure, and brief post-op care within the short time frame. Common examples of minor procedures include simple laceration repairs, small lesion excisions, and certain minor endoscopic procedures. For these, an evaluation and management service provided on the same day may require a modifier 25 if it is deemed significant and separately identifiable from the procedure itself. On the other hand, major procedures have a global period of 90 days, reflecting the complexity and the extended postoperative care often required. These include more involved surgeries like joint replacements, major abdominal surgeries, or other high complexity interventions. When an E&M service on the same or previous day leads to the decision for a major procedure, a modifier 57 is added to the E&M code to indicate that the service directly led to the decision for surgery. So, knowing that this is a minor procedure, we would pick modifier 25. Our final question, question 10. Colonoscopy performed only to 40 centimeters because the large diverticula and the inflammation seen around it. I did not want to go further. Of note, though, one of the large diverticula, I could see some blood vessels and stranding of tissue. Which modifier is added to the procedure of this case? The documentation states the colonoscopy was attempted, but the patient's condition prohibited the completion of the procedure. This procedure was discontinued. When we review the inside cover of our CPT book, we can see the modifiers listed. Modifier 53 is used for a discontinued procedure. Thank you for joining us. For more CPB, CPC practice exam questions, please visit our website at medicalbilco.com.